Hello, good morning, good afternoon, good evening, everyone. Each of us, the participants, in this third GFRA EuFMD regional workshop for Africa. You are most welcome to this third GFRA meeting and also EuFMD regional workshop. Our today's theme emanates from the public-private partnerships for progressive control of foot and mouth disease in endemic settings. And we shall have 2 days, 2 hours from 16th, which is today, and tomorrow, February 2022. My name is Frank Mwine from the College of Veterinary Medicine and Animal Resources and Biosecurity from Mckay University, Kampala, Uganda. I'm the current Global Foot and Mouth Disease Research Alliance President. This is our joint meeting. The Global Foot and Mouth Disease Research Alliance, what we call GFRA, and the European Commission for Foot and Mouth Disease, that is the EuFMD, are the leading organizations networking on FMD research and control all over the world. We have these links. I would request members to take time and you can log in to these links here such that we can see all the documents. What's our vision? Our vision is to bring together researchers, policymakers, and implementers interested and involved in foot and mouth disease control to share their knowledge, experience, and ideas. We have participants all over the globe, as you can see from these dots, and they have logged in. I thank you for logging in. Thank you very much. The summary of this year's themes and sub-themes in the 2 days are as follows. This day one, we are starting with vaccine quality, availability, and accessibility. We have got the 5 sub-themes, that is research in Africa to support vaccine quality, the importance of independent vaccine quality control, the public-private partnerships and FMD vaccines, the role of stakeholders to distribute and apply FMD vaccines, pre-qualification systems for foot and mouth disease vaccines in support to assured emergency supply options. And for tomorrow, that is the 17th, we shall be discussing the competencies to support foot and mouth disease surveillance and control, including private vets and paravets. Our sub-themes run as follows: foot and mouth disease surveillance in endemic areas, the veterinary professionals, paraprofessionals' competencies and skills for an improved surveillance. We have also research needs for improved surveillance in Africa. And finally, we shall have an overview of the progressive control pathway related to training needs and opportunities. I thank you all for logging in live, wherever you are. And I also take this opportunity to welcome you in advance to 2023 to the biannual Global Foot and Mouth Disease Research Alliance Conference that will be held in Uganda. Thanks God the following people who have made this one possible: Dr. Alejandra Capozzo from GFRA, Dr. Wirina Voslo, Dr. Nadia Rumich, Fabrizio Rosso, Alessandra Alviti, Ludovica Canella, Dr. Alice Namato from Mckay University, Kampala, Uganda, Dr. Benedicto Biamukama from Mckay University, and finally, Dr. Negandra Sanganola. So thank you very much for attending, and we welcome you once again, and I pass the baton to my colleague, Alejandra Capozzo. I thank you.
Hello, everyone. My name is Alejandra Capozzo. I am the Chief Executive Officer of the Global Foot and Mouth Disease Research Alliance, the GFRA. And on behalf of the GFRA Executive Committee, I welcome all of you to this exciting meeting on the role of public-private partnership for progressive control of foot and mouth disease in endemic settings in Africa. I want to highlight this is the third virtual regional meeting hosted together between our alliance and the European Commission for Foot and Mouth Disease. The EuFMD and the GFRA are the two leading organizations working on FMD around the world. The mission of our GFRA is to establish and sustain global research partnerships to generate scientific knowledge and discover the tools to successfully prevent, control, and eradicate FMD. So this meeting is part of our continuous effort to connect FMD research groups all over the world. We want to connect regulation agencies, funding organizations, the private sector with researchers. We believe that sharing knowledge, experiences, and novel developments is paramount to progress global FMD control. This workshop is one of the instruments we found to comply our mission. I invite all of you to enjoy these 2-hour sessions over 2 days and learn more on how to work towards the control of foot and mouth disease. This will also help us to identify research gaps and how, as a community of scientists, we can provide knowledge to reduce the burden of FMD in African endemic settings. Please enjoy the meeting. Hello.
Good morning, everyone. I'm Fabrizio Rosso, Deputy Executive Secretary of the EuFMD, and I'm just a few words to introduce this meeting, this event. And I'm very glad, and I should say very thankful for the collaboration between the GFRA and the EuFMD, and for the organization of this meeting for Africa, which is following the other two events organized for America and Asia last year. And I should say that it has been really a pleasure to see many scientists and experts in the region and outside this region interested in attending. And well, I think that with the proposed format, we also hope to overcome the difficulties we have for meeting in person in this COVID time. And we really hope that it can also assist to identify and reflect on new form of digital engagement beyond this meeting that can be used to assist the future networking, which Alejandra highlighted. It's very relevant. Coming to the topic of this meeting, well, I think it covers two important aspects of the control of FMD, and we should say probably also for similar transboundary animal diseases, which are in fact also identified as major objectives in the GFTAD new strategy. The first one is the improvement of stakeholders' cooperation through the establishment of multi-stakeholder partnership that allows not only to invest, but also to focus in a sustainable way in the prevention and control of transboundary animal diseases. And the second is really the enhancement of multidisciplinary capacity to assess, to assist surveillance and control. And really considering all individuals from public to private sectors that can contribute with their daily work to progress along the progressive control of FMD and other TADs. Well, I think that the COVID brought to the attention to the international community issues that we are facing regularly in FMD control, related to the importance of maintaining global surveillance and how to streamline the availability of vaccines, of quality vaccines, ensuring their safety and efficacy. Both aspects are covered in this event, and particularly the availability and accessibility of quality vaccines is an important issue that will be covered today, considering that significant proportion of resources are allocated to vaccine programs, but sometimes less attention is provided to the monitoring and evaluation of quality of vaccines. But also in some cases, difficulties are encountered to ensure access of vaccines to users. So with these few words, I would like to thank, well, you all for attending, particularly thank Frank, Alejandra, and really particular thanks to Wilna Voslo for the work done in the organization of this event. All the speakers and panelists, and of course the EuFMD team, Ludovica, Alessandra, Nadia, for all the support and coordination provided for this event. So enjoy the meeting, the event, and I think Wilna, the floor is to you. And thanks again for all your work in preparation of this meeting. Thanks.
Thank you, Fabrizio, and hello everyone. It's good evening here on my side in Australia. I'm Wilna Voslo. I'm part of the GFRA Executive Committee, and I'm based at the Australian Centre for Disease Preparedness. And today it is my great pleasure to introduce you to the two chairs, the chair and the co-chair, who will be managing the rest of the meeting. So first of all, I'd like to introduce you to Pamela Opperman, who's a senior researcher at the Agricultural Research Council Onderstepoort Veterinary Research Institute in South Africa, where she's been working for more than 15 years, and her field of interest includes virology, vaccines and diagnostics, particularly focusing on foot-and-mouth disease virus. She specializes on small recombinant monoclonal antibodies using phage display technology for identifying foot-and-mouth disease antigenic sites and using this knowledge to improve foot-and-mouth disease vaccines and diagnostic assays. She also has a keen interest in understanding foot-and-mouth disease virus infection and the validation of foot-and-mouth disease diagnostic assays for small ruminants. Now, her co-chair is Samia Metwali, who, by the way, I'm just going to give it away. It's her birthday today, so congratulations to Samia. Samia is a veterinarian with broad experience in veterinary virology, diagnosis, vaccinology, and control of transboundary animal diseases. She's a senior animal health officer, virologist at the Animal Production and Health Division at the FAO of the United Nations. And she participated in the preparation of the FAO OIE Global Foot-and-Mouth Disease Control Strategy and led its implementation in 87 FAO member states. She's the FAO Secretariat for Preparedness and Maintaining the Global Rinderpest Freedom. And she recently spearheaded initiatives for elimination of foot-and-mouth disease serotype C strategy and the Global One Health Regional EpiLab and vaccine and vaccination networks. So I'm going to hand you over now into the very capable hands of our two chairs.
Thank you, Wilna. So it's my great pleasure to introduce our first speaker for today, and that's Dr. Abraham Sangula. Dr. Abraham Sangula is a veterinarian specialized in immunology and molecular virology. He is currently the Deputy Director of Veterinary Services and Head of the Foot-and-Mouth Disease National Reference Laboratory in Embakasi, Nairobi. He is experienced in laboratory diagnostics, biosecurity and biosafety, livestock vaccine research, as well as the development and regulations while working for the government of Kenya, mainly at the National Reference Laboratory for Foot-and-Mouth Disease. His key responsibilities is to provide technical leadership and management for the laboratory's effective functioning in support of national, regional, as well as global animal disease prevention, control, and eradication strategies. So with that introduction, I hand it over to Dr. Abraham to give his talk. Dr. Abraham, I think you are muted.
No, I'm on.
Abraham, can you just put it on in presentation mode, please? Can I please ask our chairs that maybe we move on to the next talk, and then in the meantime, we will help Abraham in the background to load his talk. So maybe Samya, if you can just continue with the next person. Abraham, we will get back to you in the background.
Thank you, Vilna. Good morning and good afternoon, good evening, everyone. Thank you for the participation. I'm excited to see that we have a good number of participants to this event. The next speaker is Dr. Don King. I'm sure all of you know him. Don is the head of the FAO World Reference Laboratory for Foot and Mouth Disease at Ppps Institute in UK. And he's also the OIE expert for foot and mouth disease as swine fascicular disease. In his current position, he leads the international reference lab surveillance activity undertaken by the global OIE FAO reference laboratory network. He's actually been doing this, as far as I recall, for maybe almost 7-8 years. Thank you, Don, for doing that. He has a background in veterinary virology and immunology. His research group develops and applies new technologies for the detection and characterization of important livestock disease agents. These methods paramount in routine diagnostic work for the reference laboratories and Ppps, and also used to monitor the global pattern of disease and to recognize the new emerging viral lineage that pose threats to Europe, UK, and also globally. So his presentation is going to cover the importance of independent vaccine quality control. Don, the floor is yours.
Welcome, everyone. In the next 15 minutes, I aim to give a brief overview of an ongoing collaborative OIE twinning project between the Pan-African Veterinary Vaccine Centre of the African Union, which is EuFMD, and the International FMD Reference Laboratory at the Ppps Institute. This project aims to establish capacity that can be used to assess the performance of FMD vaccines in Africa, and to importantly provide empirical data that will improve the confidence to vaccine customers that vaccines are well suited to address epidemiological risks posed by specific FMD lineages that circulate in different parts of the continent. I thank all my colleagues at Ppps and partners at EuFMD who have contributed to the project, and also take this opportunity to thank Santina and EphRem at Isla in Brescia, Italy, who have helped with the work to antigenically characterize FMD reference strains for East Africa. Failure of vaccines to protect against clinical disease and transmission of the virus in the field contributes to the poor trust in these products. When vaccines fail to meet expectations, attention is often focused on the quality of the vaccine produced by the manufacturers. But I use this first slide to remind you that there are a range of other factors that can negatively impact on the success of FMD vaccines and their use in vaccination campaigns. And our project aims to tackle the first two bullet points listed here on the slide to establish a simple system that can quickly identify those vaccines that are poor quality or are not well antigenically matched to the FMD viruses that circulate in the target area. Of course, we all know that the market for FMD vaccines across Africa is complex, where customers are able to select a vaccine from a range of different international and local manufacturers, and where these companies can often formulate vaccines that contain combinations of different viral antigens at different potencies and payloads. The lack of standardized FMD vaccine strains can make it very difficult to harmonize reagents and approaches used to assess and compare the quality of these different vaccine products. And to add to this mixing pot, we also know that the epidemiology of FMD in Africa is also very complex and encompasses 5 different serotypes, so serotype O, serotype A, as well as the 3 SAT serotypes, which all exhibit an extent of and quite a large degree of genetic diversity, which also can pose a challenge for the use of these FMD vaccines. The current working framework to assess FMD vaccine quality is outlined in the OAE manual and largely focuses on the homologous performance of vaccines. Regional or antigenic relevance can be assessed using vaccine matching methods, which are also described in the manual, which provide empirical data to confirm the suitability, the antigenic suitability of a vaccine for circulating field strains. But this method does not consider the quantity, quality, or combinations of antigens that might be present in a final product. Furthermore, the extent of this testing using these vaccine matching methods is limited due to access to commercial vaccine strains from companies and the availability of monovalent bovine vaccination sera. From the perspective of the customer, a rather obvious point is that heterologous performance of the final formulated vaccine is the most critical factor. And as I explained earlier, these formulated vaccines can often contain multiple FMD components, both in terms of serotype valency and even multiple strains for the same serotype. With these points in mind, the proposed testing within our twinning project focuses on the measurement of heterologous responses using the formulated product that is supplied to the customer. And responses are measured against common standardized antigens that are representative of antigenic risks in the region where the vaccine will be deployed. This is not necessarily a new idea, and a brief outline of this approach is described in the PVM guideline document published by the OAE and the FEO. And our work to date has focused on the establishment of a regional reference panel for East Africa as a proof of concept that we hope will demonstrate the utility of this approach for other endemic pools in Africa and elsewhere. Further information about these reference antigens can be found on our website, and I just take the opportunity in the next few slides to describe how these viruses were selected and how we are starting to use them to test sera collected from animals that have been vaccinated with different FMD vaccines. The epidemiology of FMD in East Africa is often described as comprising a single endemic pool where serotypes O, A, SAT1 and SAT2 are present in domesticated species. However, FMD virus sequence data shows us that there are at least two discrete ecosystems present in the region where viruses that circulate in countries in the north, such as Ethiopia, are discrete from those viruses circulating in countries located in the southern part of the region, such as Tanzania. And you can see from yourself from this slide that specific viral lineages for three of the serotypes, OA and SAT2, are different in the north and south. And the fourth serotype, SAT1, has not been detected in countries in the north, such as Ethiopia, since 2007. SAT3 is also present, but this is predominantly only found in wildlife in countries such as Uganda and has not been considered for inclusion in the antigenic panel. We've used available FMD sequence data to select candidate FMD virus isolates that might be included into these reference panels. And this slide presents the VP1 phylogenetic trees for all of the available sequence data in the WRL collection. The colored dots represent candidate viruses, which were more than 50 viruses that were selected from each of the viral lineages that are believed to be present in the region and can be considered as contemporary epidemiological risks. And these viruses individually were grown up in IBRS2 cells and were selected for use based on their growth characteristics and viral titer. The 16 viruses in the panel were selected to encompass the greatest extent of the amino acid sequence diversity, and this work was undertaken using a greedy algorithm to select those viruses that were most distinct from each other. And the larger dots highlight these 16 viral isolates that were taken forward as reference antigens. Recognizing that genetic diversity does not always easily translate to differences in antigenic phenotype, we have also undertaken work to characterize these isolates using monoclonal antibodies and sera from vaccinated and/or infected cattle. I don't have time to present all of these data today, but just to give you a flavor, this slide shows data for serotype A viruses in the panel where results of monoclonal antibody binding is shown at the top, and virus neutralization testing using cattle sera is shown at the bottom, and these are represented as heat maps. And hierarchical clustering analysis has been used to group the virus isolates with similar responses, and you can see this in the tree represented at the left-hand side of these figures, providing confidence. And here I highlight the selected isolates with the yellow lines here. The selected isolates are antigenically different from each other and represent the greatest extent of variability that exists across these different viral lineages. We've been using the panel to assess post-vaccination responses and have undertaken a series of vaccination studies both at EuPanVac and at Ppps in the UK to test a whole range of vaccines, including most of the vaccines that are supplied into the East African market. We, at a later date, will plan to present all of these data in a collated way so that you can see the real empirical data for these vaccines. But for today's presentation, I prepared a slide with illustrated data, simple illustrated data, to try to show you how this heterologous testing system works. So here on the slide, we have comparative data for post-vaccination responses for two different vaccines, vaccine 1 and vaccine 2, where the virus neutralization titers against each of the 16 reference antigens, 4 per serotype, colored with a different color, are shown. And using this simple approach, you can immediately recognize vaccines that elicit poor responses to one of the serotypes, in this case, SAT2 for vaccine 2, which where you can see none of the antigens contained in the panel are neutralized. But you can also highlight individual antigens in the panel, and here the example is a serotype A antigen that is poorly neutralized by the sera from both vaccines, which perhaps are indicative of antigenic novelty, which hasn't been addressed by either of the vaccines. In this example, very simple example, I've shown you mean serological titers for 5 animals per vaccine, but of course, a much more comprehensive way of looking at the data would be to analyze the data individually to look for animal-to-animal variability in these responses. This simple testing approach generates data to assess the suitability of vaccines against regionally relevant Fmd virus strains. And compared to vaccine matching, this system has a number of advantages, including complete independence from the vaccine supplier, since access to the live master seed strains from the companies is not required for the testing. Importantly, this approach assesses vaccine performance using the final formulated product, and if standardized protocols are adopted, these data can be easily applied to compare responses for different vaccines, although of course statistical advice is probably needed here. We also imagine that testing can be tailored to different scenarios. At one extreme, sera can be requested from the vaccine producers, and testing can be undertaken as part of the tender process to select an appropriate vaccine for use. At the other extreme, studies can be driven by the customers in their host populations to provide confidence that the purchased batch of vaccine has elicited the expected spectrum of immunity in the vaccinated animals. The 16 viruses described in the East Africa panel have already been supplied to other FMD reference laboratories. And in terms of future priorities for this work, we can see that similar panels could be prepared from the other endemic pools in Africa and elsewhere. And as part of the selection process, full capsid sequences are generated and shared. And for the East Africa panel, these are available on our website. And of course, there is scope to continue the work led by ISLA to antigenically profile these viruses using monoclonal antibodies, as well as the continued testing using reference anti-sera to assess the antigenic variability of the viruses in the panel. An important message from this work is that sera collected from the vaccinated animals can be very useful. And together with EuPanVac and other partners, we are starting to put together a panel of representative sera with the prospect that these serum samples can also be shared for further comparative testing. Interlaboratory equivalence for this testing is likely to be an important issue, and work to calibrate the VNT methods that are used in the different FMD reference laboratories underway. And we have a small project funded by EuFMD, which will assess the comparative responses in some of the reference laboratories that might be undertaking this work. And in view of the inherent variability, reliance on VNT needs to be carefully considered. And we're also currently working within the project to develop new structural protein ELISAs, and as well as calibration of existing ELISA tests to hopefully allow some of the serological testing to be performed by laboratories that do not handle live virus and culture live virus. I've deliberately not mentioned serological cutoffs that define protection because we know this is a challenging and a difficult issue. Although we know that there is a relationship between antibody titers and protection, defining specific cutoffs can be problematic, since we know that titers that correlate with specific levels of protection are different or can be different between virus serotypes and even strains. And quite importantly, there are very few heterologous challenge studies have been performed, which may give us data that will help us inform these cutoffs, particularly for African field viruses. And where studies have been done, laboratories often obtain different titers when testing the same sera, and this perhaps links to my earlier point regarding the calibration of these VNT tests. The other issue, perhaps thinking about cutoffs, is due to animal variability. The correlation is often not reliable for small groups of animals. But I guess, although there is more work to be done, I hope you can see that this simple approach will provide FMD vaccine programs with empirical data that can be used to compare the performance of available vaccines and to demonstrate that products are sufficiently tailored to address FMD epidemiological risks. If you need any further information, please do feel free to drop me an email. And I'd like to briefly conclude by acknowledging the OIE who have supported this twinning project. And I'd also like to thank the commercial companies who have willingly engaged within the project to provide sera and vaccines for testing, as well as the technicians at Pirbright and EuPanVac who have helped with the animal studies. Thanks for your time, and I'm happy to answer any questions during the panel session later.
Thank you, Don, for a good presentation. Pam will introduce the next speaker.
Thank you, Don. Yes, so we're going to be moving on to our next speaker, Mr. Vadi Maludi. He is from AgResults GulfMed. Vadi Maludi has more than 18 years of commercial development experience in the agricultural, pharmaceutical, and veterinary sectors. He has worked with public and private sectors in Eastern Africa to foster collaborative partnerships, promote sustainable development, and improve livelihoods. Currently with GulfMed, Mr. Maludi serves as the Biorelations Lead for the AgResults Foot-and-Mouth Disease Vaccine Challenge Project, an 8-year, $17.68 million pay-for-results prize competition that supports the development and uptake of high-quality FMD vaccines tailored to meet the need of Eastern Africa. His principal role is to create project awareness and gain commitments of public and private sector stakeholders in the project's target countries. So over to you, Mr. Vadi. We're looking forward to an interesting talk.
Hello, everyone. Thanks for that wonderful introductions. Welcome to this presentation on public-private partnership and FMD vaccines. My name is Vadi Maludi, as earlier introduced. I do work with GulfMed on a project that is sponsored by the AgResults Initiative. So just to give a highlight of the presentation, I'm going to go through the AgResults FMD Vaccine Challenge project for the interests of those who have never engaged with the project to know what we're doing. Then I'm going to give a detailed presentation on the work that we did on a PPP framework that we developed alongside other key stakeholders in the Eastern Africa countries. And I'm glad to say that some of those stakeholders who contributed to this PPP development are present in today's meeting. So we welcome their comments in the discussion room. So the Ag Results as an initiative, it's a multi-donor initiative that uses pay for results price competition to incentivize the private sector to invest in high impact agricultural innovations that help achieve 3 goals. That is reducing food insecurity, improving household nutrition and health, as well as increasing livestock productivity. It is funded by several donors who are listed below here. So coming down to one of their projects, the Ag Results Foot and Mouth Disease Vaccine Challenge project. This is an 8-year, 17.68 million prize competition that supports the development and uptake of high quality Fmd vaccines tailored to the Eastern Africa region. And the focus countries are Burundi, Ethiopia, Kenya, Rwanda, Tanzania, and Uganda. So the project aims to deliver on 3 objectives. The overarching objective is development and registration of high quality Fmd vaccine tailored for the needs of East Africa. Secondly, we also want to increase vaccine production and regional purchases to create a greater market stability and reduce prices, as well as development of a private sector model for buying and distribution of Fmd vaccine to complement the public sector. The framework was developed within this 3rd goal of a private sector model. So to achieve this objective, we propose the development of a comprehensive mechanism known as a cost share, which is designed to include both public and private sector buyers. Moving on to highlight on the project to date. The project itself was launched on the 22nd of January 2020 in Rome, Italy, alongside a vaccine security meeting. And several manufacturers were invited, more than these ones who are listed here. And we've been engaging with several of them on the development of that vaccine. And we can announce here that we expect a vaccine dossier to be submitted for registration in this current year of 2022. Now, going into our topic of discussion, the project did actually carry out development of a PPP framework with the aim of addressing challenges in the Fmd vaccine value chain. So the overall goal was to create awareness about the benefits that PPPs can bring to the foot and mouth disease vaccine value chain in the Eastern Africa region in areas of production, purchasing, distribution, delivery, vaccinations, as well as post-vaccination monitoring to complement the current public sector efforts, resulting in improved vaccine accessibility for farmers, as well as greater market stability. The PPP framework was not developed in isolation. We actually wanted to customize aspects of the PPP handbook into a practical framework that can be further developed into appropriate commitments between partners. This framework that now we have completed addresses the challenges of the Fmd vaccine value chain, and it is relevant to the unique Fmd control situations in each of the project target countries. But we also believe it can also be applied more broadly to other livestock vaccine value chain, as well as to other geographies beyond Eastern Africa. So through the journey of PPP framework development, the project team conducted outreach to more than 140 key stakeholders in Eastern Africa and beyond. And of those 140, 47% came from the public sector and 53 came from private sector. And the 2 columns here highlight the sectors from where the stakeholders came from both public sector as well as the private sector. But we also had engagement with and collected view, as well as got valuable contributions from global and regional institutions, including the OIE PPP team, the EuFMD, East Africa Community, AU PANVAC, IGAD, ICPAL, AU IBA, and FAO ECTAD. So we are grateful actually for those contributions from this organization, as well as the stakeholders who participated in this PPP development. So moving on, the next slides, I would be capturing or give up a highlight of what the PPP framework captured in the document itself, beginning with the general overview of PPPs in Eastern Africa, where it was established that legal and administrative structures for PPPs in Eastern Africa are only limited to infrastructure development, energy, and water sectors. Actually, there are PPP units that exist, but these are situated in ministries of finance and economic development. So stakeholders felt that there is a need to establish links between the respective PPP units and the agricultural sector to be able to create an enabling environment for PPPs in the Fmd vaccine value chain. Secondly, stakeholders did acknowledge gaps in current public sector provisions for Fmd control. Most common gaps identified were poor vaccine supply and vaccine coverage, reactive and ad hoc procurement of vaccines, and lack of involvement of private sector in Fmd control. Overwhelmingly, the stakeholders unanimously agreed on the need for PPPs in Fmd vaccine value chain. The second feedback from the framework is on PPP challenges and opportunities. And in these two slides, in these next two slides, I'm going to highlight what were identified as opportunities and challenges for PPPs in the Eastern Africa region. This first slide covers the three most priority areas identified in all the 6 countries. Number one is a high cost of vaccination, where public sector vaccinations are typically carried out by the government vets with high costs incurred to facilitate travels to remote areas. So areas of opportunities were identified for PPPs with private veterinarians and veterinary paraprofessionals. The second high priority area was limited capacity in vaccine supply chains. And as we all know, the current Fmd vaccines, they need a cold chain distribution process to maintain efficacy. So PPP opportunities, there are 2 PPP opportunities identified from this challenge. PPP with a vaccine manufacturer to invest in enhanced public sector cold chain. And number 2, PPP to outsource cold chain distribution to private sector. This could be private distributors, veterinary clinic, as well as partnership with veterinary paraprofessionals. The third key challenge was the long vaccine supply lead times. Typically, Fmd vaccine production process takes 2 to 3 months, and vaccine delivery adds another delay. This issue is more compounded when you look at the typical reactive approach to Fmd control and vaccine purchases. So opportunity area was identified for PPPs with Fmd vaccine manufacturer for a projected supply and or supporting the process of demand forecasting. So these are the key key major PPP opportunities identified. But there are other also 3 areas that were identified that were either more relevant into one country than another. So going into number 4, challenge number 4 is challenge in the current vaccine to address the regional Fmd risks. So stakeholders felt there is a need to develop and produce a high quality vaccine relevant to the region. And in this area, PPP opportunity was seen to be between a local government manufacturer and an international vaccine manufacturer. This was high potential in Tanzania, Ethiopia, and Kenya. These three countries have already facilities for vaccine production in the countries. So this one was a very clear indication there could be PPP opportunities to be pursued here. Point number 5 is challenges with serotyping and vaccine matching. There are limited facilities and budgets, as well as infrastructural mechanism to carry out effective serotyping and vaccine matching. Opportunity areas identified were PPP with existing laboratory institutions, as well as PPP with potential local dairy or meat associations to help with capacity building and equipment upgrades to be able to carry out serotyping and vaccine matching. The last point in terms of opportunity and challenges was the limited post-vaccination monitoring. Currently, there is difficulty to measure the effectiveness of vaccination campaigns. So an opportunity area identified was PPP with veterinary paraprofessionals to be able to ensure proper coordination of data analysis and subsequent plan of actions. So moving on from the challenges and opportunities, the framework also established some enabling environment challenges that are hindering establishment of PPPs in Eastern Africa. The first point was the key landscape and the enabling environment challenges that included unclear policies and absence of legal framework for PPPs. Secondly, trust issues between public and private sector stakeholders, but also there is a budget shortage and financing of PPPs. The point number 2 also, the framework captured areas of support that are needed to establish PPPs in the value chain. And the priority areas were seen to be training, awareness, raising, and advocacy for PPPs among the stakeholders to be aware on the benefits that PPP brings to the vaccine value chain. Secondly, there is the development of an institutional framework, legal framework, and a PPP technical unit in the agricultural sector, and also provision of portable cold chain storage units to be used in field settings. So having completed the PPP framework, we have a call to action for implementation of this PPP framework. And in our objective number 2, we want to promote the use of the PPP framework in manufacturing, purchasing, distribution, and vaccination campaigns. From these, we are trying to engage and identifying partnerships to promote the PPP framework in the target countries. So we welcome stakeholders' inputs, ideas, concepts for formation of PPPs for vaccines and veterinary health. To give example, currently we've been following up discussions and engaging with the EuFMD VPP project in Uganda. We've had discussions with Mercy Corp Uganda on their plans for a PPP pilot for vaccine distribution in the Karamoja area in Uganda. But we want to encourage discussions also in overcoming challenges in establishing PPPs in the region. And finally, we would want to facilitate development of PPP MOUs, contracts, and or informal partnership agreements in the target countries. In this last slide, we are offering additional resources to stakeholders who want to follow up or read more on the PPP framework. So these links can take you to the framework document where you can read more on what was captured from the stakeholders. But we also encourage interested individuals to sign up to on the project website to receive updates about project milestone. So thanks a lot for this opportunity to present, and I really appreciate your participation and listening to this presentation. Thanks a lot.
Thank you, Badu, for that very good talk. And I'll hand over to Samia to introduce our next speaker.
Thank you, Pam. We have an outstanding presentation coming up. Actually, I would like to thank you all for putting a question and answer in the QA box. This is a lot that we probably try to cover by the end of this meeting. Thank you for that, and continue doing it. So our next speaker is Dr. Mazwa Duma. He is a veterinarian, graduated from University of Queensland, Australia in 2007. Following his graduation, he joined the government of Botswana at the district veterinarian office, where he actually focused on FMD surveillance and outbreak control through vaccination and movement control. In 2009, he joined the Botswana Vaccine Institute as a vet for sales and marketing. And a few years after that, he became the manager for that in 2012. In 2013, at BVI, he has been a primary control of BVI with its customer, ensuring efficient planning, production, distribution, and delivery of vaccine orders, including Fmd Vaccines. His talk is going to be on availability and use of Fmd vaccine and the role of stakeholder. The floor is yours, Dr. Mazdawi.
Thank you very much, Samia. Good morning to everybody. Thank you very much. Good morning once again, colleagues, wherever you are in the world this morning or evening or afternoon. Let me thank the organizers of the meeting for affording us this opportunity to present a few slides. My presentation is on the availability and use of FMD vaccine, and really what is our role as stakeholders. So that is just a brief outline of the presentation. I'll try and set the scene. I'll talk a little bit about the drivers and stakeholders, and then I'll talk about usage, what is the current situation, and really what is the ideal and what can be done. So as you can see, I won't go into too much detail, but I take it we all understand the complexities of FMD disease. It's multifaceted in terms of its transmission. And this really is what poses a major challenge on our continent because there are so many different transmission routes. I've borrowed that map from EuFMD that just showcases the current situation of FMD across the continent. And I take it that we'll all appreciate that really the disease is everywhere. And really we need collective stakeholder collaboration to change the color of this map. And you'll also appreciate that one of the challenges we face as a continent is that due to the low mortality of FMD, you find that in many cases it's been relegated in terms of control in preference to other diseases of high mortality such as your CBPPs and your PPRs. So that is another challenge that we have. And I think we are also aware that in terms of the PCP, despite a lot of work that has been put in by FAO-OIE, you find that the majority of us African countries, we are still at the lower end of the PCP. And I take it that Dr. Lithuania will come and address that in his presentation. Just finally, as a way of backgrounding, I strongly believe that the lack of structured interventions is leading to a lot of lost economic opportunities. We talk of huge livestock resource on the African continent, and we are all aware that there is massive opportunities now because there's a lot of demand on African countries in terms of live animals and livestock products, both for regional trade as well as for international trade. And to be able to get hold of those opportunities, we really need to harness our efforts on FMD control. So my question to everyone here is, can we really continue to lose such opportunities on the continent when we have available tools to tackle FMD, including vaccination? So in terms of availability of FMD vaccines, my belief is that really we need to start pre-production. And by pre-production, I'm talking about we really need to improve the ability of farmers, private vets, technicians, animal health workers, community animal health workers, whatever you want to call them, in terms of disease recognition, and there being a regulated framework in which the FMD disease can be reported. This for me is the cornerstone which will then feed into the funnel of real issues of availability that will come to the manufacturers. So DVS, together with other stakeholders, non-state actors, they have a real responsibility of really creating awareness through FMD education, as well as providing a legislative framework for FMD reporting. This is very, very important. And then after that will come the issue of sample submission for confirmatory diagnosis and virus characterization. This is very, very important, including vaccine matching. And I think Dawn's presentation was really able to showcase some of the shortcomings of the vaccines. And I think my key message here would be that we really need to move away from serotype to serotype, where someone will say, I have a SAT2, does your vaccine have a SAT2? It means there's a match. No, we need to get down to strain matching, where you ensure that the vaccine strain is adequately matched to the field strain. So this is very, very important. When we come to the responsibility of an important stakeholder being the manufacturers, I refer to what we call the Big Five principles. This is something that has been coined by our technical partners at Boehringer Ingelheim Animal Health. And these Big Five principles really talk to, firstly, the appropriateness of the vaccine strains and their relevance for the areas with which they're being provided. So this is very, very important to ensure that FMD, there's a lot of variability as has been shown from Dawn's presentation. So it's really, really important that we provide tailor-made vaccines for each particular area that we're dealing with. When we come to the issue of quality of adjuvants, you'll recall in the previous presentation, there was talk of the failure of product in terms of duration of immunity and so forth. So really, as manufacturers, one of the major responsibilities in terms of the quality of the adjuvant, aqueous oil, and in terms of onset of immunity and duration of immunity, this is very, very important. Thirdly, when we talk about appropriate potency of FMD vaccines, we really need to make a distinction from routine FMD vaccines, which would be a 3PD50, versus emergency FMD vaccines, which would be 6PD50 and above. This is very, very important. The other factor is also the safety of FMD vaccines. It was just been alluded to in the previous presentation as well. Issues of customers saying that I've used the vaccine and immediately afterwards there's an outbreak. So in terms of inactivation, very, very key, and also ensuring that there are no post-reactions post-vaccination. So this really is about building confidence in the product and confidence in customers to continue using the product. And then lastly, the issue of purity of antigen to allow for DIVA. I believe that we are now at the stage where really all FMD vaccines should be purified to allow for improved surveillance and also to allow for the ability of countries who are using these products to be able to trade in those vaccinated animals, and purified vaccines, which would differentiate infected from vaccinated animals, is very, very important. And at the bottom there, it's very, very critical, and I think that was part of Dawn's presentation, that we really need a structured, independent quality control actors on the African continent. And I believe the project with AU PanVac is really, really critical in ensuring that there's quality assurance of FMD vaccines that are going to be used across Africa. This hasn't been the case in the past, but I think the work that will be done will be very, very important. Moving on to issues of planning. I think there was some mention in the previous presentations about lack of availability, but the stark reality that we are all dealing with, especially as manufacturers, is that there is a culture of emergency vaccination as opposed to preventative vaccination. And this really affects availability in that it's been explained that production takes some time. So really we need to build a culture of proper forecasting and planning. And I think there was mention of Ppps for that, such that this will improve availability of product. Another option as well is the option of having regional hubs, which could also work through a PPP, whereby the existing manufacturers are able to partner with other manufacturers who may not be producing FMD and be supplying bulk antigens for fill and finish. This could be a model that could be looked at to increase availability of FMD vaccines on the continent. And then the issue of emergency or emergency vaccines or antigen reserves, or whether you want to call them banks. This is another area that could also improve on availability, because these are facilities that will ensure that within a rapid period of time, sometimes within a week, vaccines are able to be available. But I caution to say that such mechanisms require upfront commitment of customers. So that's a very, very important element. And lastly, issues of logistics for distribution. I think we are all aware of the challenges that manufacturers are facing in terms of moving product across Africa, in terms of freighting. COVID hasn't been kind to us. Freight rates have increased dramatically. So I think the issue of regional hubs could come in and address that. And that would, for me, would be key in ensuring that products are readily available when needed. So moving on to the issue of usage, I think we really need to work on a value proposition that is able to really inform clients all the way from state to non-state on the benefits of FMD control, including through vaccination. I'm talking here about economic impact studies. I don't think there's enough out there to really demonstrate the benefits of FMD control through vaccination. And as I've said, there is a huge untapped livestock resource on the African continent, and there's a great demand for it. We know that countries from the Middle East are looking for livestock products across Africa, and other players as well as regional to regional trade. So I think there's opportunities there for non-state actors, academia, to really come up with these economic impact studies to show the benefits of FMD vaccination, and this could improve on issues of usage. And then in terms of country position, I think there is a big challenge, and I think it's been mentioned, where you find that there's a lot of government control or government red tape that really hinders the private sector. I think we are now at the time where really state actors should let go and allow the private sector to be more involved in FMD control in a regulated manner. You'll find that in many situations in countries, FMD control is the purview of the state, and you find that private actors, your dairy farmers, your commercial farmers, are really struggling to get products whilst waiting for government to come to the table. So we really need to allow and liberate the private sector to be involved in FMD control in a regulated manner, and I think this could improve the issue of usage. And in terms of regularity and sustainability of vaccination programs, this has been mentioned before, the erratic nature, firefighting. This is really not a sustainable model. And I really am looking forward to the Ag Results project. And I hope it can be replicated across the continent, because the cost share approach will allow the end user to understand the benefit and in the end be able to stand on their own 2 feet and continue the usage and uptake of FMD vaccine. And lastly, the issue of post-vaccination monitoring is absolutely critical. not only for the producer, but also for the user, because I believe this builds confidence in the intervention. If government is giving you a lot of money to spend on FMD and you're not able to show the benefits of the intervention at the end, then really, as one of my old professors would say, you are winking in the dark. So this is really, really important. Post-vaccination monitoring is critical to show exactly the benefits of the intervention. So my last slide is just to say, as a way of moving forward, I emphasize again the issue to bring in the private sector. This is very, very important. The economic benefits of FMD control through vaccination should really be put out there. And I think that's when countries will have a change of mindset and stop relegating FMD to the lower levels because of its low mortality, but really put FMD at the top in terms of control as a way of improving livestock's contribution to GDP and as a way of economic recovery as well. The capacitation of regional control bodies of EuPanVac, I've said that before, is really, really absolutely critical for ensuring that we have the right fit-for-purpose vaccines to be used on the continent and the ag results to be replicated across the continent. And lastly, quality assurance through such issues as post-vaccination serological monitoring. So thank you very much for the opportunity. Thank you, Samia. And lastly, as I say, really FMD vaccination is key in unlocking Africa's huge livestock potential for the benefit of not only our forefathers, but for the benefit of livestock keepers. Thank you very much.
Thank you, excellent presentation. I really liked the last slide, and we see how we're going to implement our recommendation here. It's probably going to be a challenge, but I think we are on the right track for Africa. Absolutely. So I give the floor to Pam to introduce the next speaker.
Thank you, Samia. So our next speaker is Dr. David Mckay. Dr. David Mckay qualified as a veterinary surgeon who started his research career in exotic viral diseases of livestock, culminating as the head of the Purbright Laboratory for the Institute of Animal Health. David subsequently moved into the regulatory area, assuming the posts of head of immunologicals and then the director of licensing at the Veterinary Medicines Directorate in the UK, before moving to the European Medicines Agency as the head of veterinary medicines. David retired from the EMA in 2018 and now provides independent advice to governmental and non-governmental bodies in relation to regulation and the use of veterinary medicines. He has collaborated on the pre-qualification system of FMD and similar TADS vaccines and other activities such as the multi-stakeholder platform on vaccine security. So I'll hand you over to David to hear about his talk about pre-qualification systems for FMD vaccines and the support to assured emergency options. Thank you, David.
Thank you very much, Pamela. I'm just sharing my screen and hopefully everybody can see that now. Just clear it up a bit. Okay, so what I'm going to do is touch on a number of the topics that you've heard about today about the requirement for assuring the quality of the FMD vaccines that are used. If you can't assure the quality of the vaccine at the very outset, then of course every other step in the chain becomes uncertain. And if you get no result, you don't know whether it's because you didn't have a good vaccine or you didn't apply it appropriately. So I'm going to describe some work that Fabrizio at EuFMD has asked myself and Dr. Martin Eilert, who's also on this call, to work on, and that's the development of a pre-qualification system for foot and mouth disease vaccines that will assure or contribute to a system for supply of assured quality vaccine in the event of need. I'm going to run through the slides fairly quickly, I should warn you, because there's quite a lot to cover in just a short space of time, but don't worry, they will be distributed after this meeting today. So if you don't get a chance to read all the text on the slide, because they are quite text heavy, don't worry, they will be supplied afterwards. And the main thing is to try and highlight the important points. So having some difficulty changing. There we go. So I'm going to talk a little bit about general principles of assuring the quality of the vaccination, then tell you what pre-qualification is, why that's of interest to the EuFMD, who will be able to use the system once it's set up, and how it fits within a wider context of assuring the supply of quality vaccines. I will, and then that it did on its own. I do apologize, I'm having some problems here with the slides. Doing their own thing completely, taking absolutely no notice of. Right. So in terms of the quality of vaccines, really, you look at three different elements to assure the quality. First is the documentation provided in the marketing authorization to check that the manufacturer produces it to an adequate quality, knows what they're producing and tests it properly. Then there is the manufacturing authorization requiring suitable inspection of the plant to check that the facilities are up to relevant standards of good manufacturing practice. And then finally, there's sampling and testing of the final product. I think it's always worth remembering the maxim that you can't test quality into a vaccine. Therefore, the first two elements on this list in terms of checking the method of manufacture and that it's actually manufactured in appropriate facilities are extremely important, as well as testing of the final product. Of course, for foot and mouth disease vaccines, you then also have to assure that the product you produce is not only of high quality, but is also fit for purpose. So in terms of, this has been mentioned really before, when people want vaccines at the moment, it's really a question of case-by-case procurement based on information obtained from reference laboratories around the relevance of vaccine strains for the strain circulating in a particular country, and then these vaccines meeting those criteria will be sought on the international market or local market and purchased from manufacturers. And this requires a case-by-case evaluation of the quality of the vaccine, and that the evidence that's provided by the manufacturer is then evaluated each and every time a tender is done. So what are we aiming to do with pre-qualification? And this is really an independent assurance that vaccines meet at least the minimum standards in the OIE manual. And that's the key message from the presentation today. That's what we're trying to do with pre-qualification. So, and in order to do that, the manufacturer would need to supply evidence on the pharmaceutical quality of the product, on its safety, as has been talked about, on the efficacy. When we talk about efficacy, we really mean there that the manufacturer can provide evidence that the vaccine performs as they describe in the labeling and the other literature supplied with the vaccine, in terms of onset of duration, onset of immunity, duration of immunity, the particular strains that are in there, all of the other properties that you would want to know about a vaccine, and also that the manufacturer can provide evidence that the product is manufactured according to the principles of GMP. So who's this system for pre-qualification going to be used by? Well, we hope that manufacturers will see that it's a very useful system because it allows an independent review of their product. It's very important to emphasize that pre-qualification is not a regulatory procedure. So regulatory procedures are carried out by individual national competent authorities of products placed on their market. This will look at that information that has been provided to national regulatory authorities, and the fact that they found that the product is suitable quality, and will give an overall view as to whether it then complies with the OIE international minimum standards. Why is that necessary? Well, not all regulatory authorities are fully experienced with vaccines as complex as FMD, and in fact in some countries the regulatory authorities are not really very functional, and therefore this system is particularly useful for countries with inexperienced or poorly developed regulatory authorities. Just to say, where a product has already been approved by a fully competent and experienced regulatory authority, the system for PQ is really is accelerated and is very simple because there is already that assurance that the product has been very deeply and thoroughly assessed. So, having done that, the aim is that you look at the dossier and then you put it on a list of vaccines. And this will then be very useful for risk managers because it should remove the need for this case-by-case assessment of quality each time that they have to procure vaccines. If it's on the PQ list, that should provide sufficient assurance of quality. Sorry, just go back again. So I don't really want to go into this in too much detail, but as I say, it's a voluntary system. The applicant submits an application containing the relevant information. This is reviewed by an independent panel of experts who make recommendations to an overall steering committee, who will then say, yes, this product meets international standards, or no, there are these deficiencies in the data. The manufacturer can then address them if they can. But the end result is that there is a list of vaccines which meet minimum international standards. So how does that fit within the longer term supply arrangements? We've heard about vaccine banks today. There is also the possibility of not actually establishing physical vaccine banks, but establishing long-term contracts with manufacturers to supply vaccine of a defined quantity in a defined amount at an agreed price as and when it's needed. And this is what we mean by long-term supply arrangements. And by using such arrangements, it's actually a form of cost sharing between the public and private sector, because both the manufacturer and the purchaser of the vaccine effectively share the risk and cost for storage of antigen. But by doing it in this way, in fact, it helps manufacturers because it reduces wastage of vaccine that's been produced. It allows them to rotate antigens. There are various reasons why such a system is of benefit both to users and manufacturers. And we see PQ fitting very well into that model for vaccines, because it means that when the product is eventually formulated for use or supplied, you know exactly the quality and characteristics of the vaccine that you're going to get. So it has benefits for both the user and also for the manufacturer, because it enables them to predict supply better and reduce the risk for entering the market for foot and mouth disease in certain countries, because they already have a contract for supply when needed. So I've described the system and what it is, what it aims to do. This is, if you want more information, then you should follow the link on this page, which is a dedicated web page on the EuFMD website, where you can find this document that describes this whole procedure in more detail. Dr. Eilert, who's on this call today, and others within the team at EuFMD are now working very hard, and Martin is the project manager for this implementation, to actually now put this system into place so that applications will be able to be accepted by the end of 2022 from volunteer companies, because this is an entirely new procedure. It's important to ensure that it works as it's been planned. So the aim is to engage with volunteer companies in the first instance, and then review this system and then make it fully operational for anyone who wants to apply in 2023. So how could this apply to Africa in particularly? And this is my final slide, and it relates back to what what has been talked about in other presentations. We see this as a way of providing assurance to risk managers, those who purchase vaccines, that the vaccines they buy at least comply with the OIE minimum standards. It also allows confidence that the characteristics that are described on the label and in the other literature about that vaccine have been independently verified. And if it says what it, it does what it says on the label, effectively. It gives information about what strains have been approved for inclusion in that vaccine, and that can be very useful when combined with information from FMD reference labs to select appropriate vaccines for use on their territory. So it will assist national regulatory authorities, but again, it's really important to make the point. The intention of PQ is not to replace the need for national import controls or marketing authorizations, but to assist those countries with less developed marketing authorization approval systems and regulatory systems. It will assist them. And it's just to say, we've modeled this whole system on how PQ operates for human vaccines in WHO, and that has proven to be extremely useful over the years, and so we want to take that model and adapt it to the veterinary side. And then we've talked about PanVac several times in the presentation today. And just to say, PanVac is a member of the steering committee on pre-qualification, and PanVac, we also envisage having a key role in this PQ system for vaccines for the African market, because they are the laboratory that is assigned as the vaccine quality control laboratory for Africa, and therefore this PQ system fully recognizes the importance of involving PanVac in that quality assurance. And so thank you very much, everybody. I'm sorry that was quite a rush through, but I hope it was interesting for you today.
Thank you, David, for that very good talk. So now we're going to go back to Dr. Abraham Sangula, and then for his talk, I would just like to give you a short recap of who he is. So Dr. Abraham Sangula is a veterinarian specialized in immunology and molecular virology. He is currently the Deputy Director of Veterinary Services and Head of the Foot-and-Mouth Disease Reference Laboratory in Nairobi, where his key responsibility is to provide technical leadership and management for laboratories' effective functioning in support of national, regional, and global animal disease prevention, control, and eradication strategies. So over to you, Dr. Abraham.
Thank you very much, Pamela. Sorry for the mishap, but it gives me an opportunity to summarize my presentation, because most of what I was supposed to say has already been highlighted. And I'll just take this opportunity to give a summary. So, already, as already said, my name is Abraham Sangula. I'm from the Foot and Mouth Disease National Laboratory in Embakasi. I was given the opportunity by GFRA and the EuFMD to say something on research to support FMD vaccine quality, specifically for Africa. What I will try to give you the summary now is that already we know that foot and mouth disease, as has been said by previous presenters, is endemic in Africa. But what I wish to highlight here is the existence of FMD in Africa has been identified to be in 3 regional pools that are mostly, you can identify them geographically, there is the Eastern Africa pool with occasional spread to North Africa, which consists mostly of serotypes O, A, and the two SATs, that's SAT1 and SAT2. A similar situation occurs in the Western Africa with spills into the Maghreb region of Africa. The other pool of FMD viruses is the South African territory types, the SATs that are restricted more to the Southern Africa. Southern Africa at the moment also is facing threats from the Eastern African pool. That is, there are indications of spread of type O southwards. But generally, as said, geographically, you can think of those three African pools. So in terms of vaccines, you could also be looking at concentrating on the relevance of what serotypes exist in the region. Now, as I said, previous presentations from Dawn, from Maziduma, even Badi have highlighted the challenges of vaccine availability and usage in Africa. We know that the Fmd vaccines have played a very important role in the global foot and mouth disease control and eradication programs. Success stories do exist. In Europe, FMD was largely eradicated through vaccination, such that by the early 90s, FMD was declared eradicated in Europe. Southern America is in the same path of eradication of foot and mouth disease, and vaccines have played a very important role. Most of these successes have been due to use of conventional FMD vaccines, and these are generally manufactured from virus tissue culture, cell culture inactivated vaccines, and adjuvanted, of course, with the either oil or aluminum hydroxide. The successes in South America have been attributed to the use of oil-based vaccines, which confer longer immunity. But the challenge with these conventional vaccines is that they require highly biosecure production facilities. There is a cold chain requirement, need for multivalent formulations, and a well-noted short duration of immunity, in most cases 6 months or less. And as highlighted by previous presenter, there is the need for purification to differentiate vaccinated animals from non-vaccinated from infection. So with all these challenges, which have been well enumerated before, I would summarize them as in Africa generally, there is a shortage of quality FMD vaccines. And the other big challenge is most of the vaccines produced in Africa are manufactured by very few producers. At least I know of only about four or five countries that have capability to produce. There is the OVI in South Africa, which is currently not in production. There is the BVI, NVI in Ethiopia, but all these produce insufficient vaccines. The other issue that has been highlighted also is the lack of independent evaluation of the vaccines, and also the limited monitoring of field protection. All these have been well enumerated before. So what was I to say now should be our way forward? In order to support quality vaccine availability in Africa, all these should aim at improving the vaccine performance. And the other key factor is the achieving of cost effectiveness. In that case, therefore, what should we focus on as research needs for availing quality vaccines for the African region? In this case, do we look at the production of novel quality vaccines? These have been looked at to be able to, for example, try to mitigate the huge investments required to produce FMD in biosecure environments. Can we take advantage of the new technologies, like, for example, the use of vectored vaccines as a way to produce another set of effective products? But in my consideration also, I was thinking that improvements in the measurement of antigen content, improving our potency testing methodologies, and measuring vaccine field effectiveness could be some of the areas that we should concentrate on as the research needs. So in that case, David Don this morning gave us a very detailed presentation on some of the research efforts towards meeting some of these objectives of supporting vaccine quality in Africa. Among those are the use of alternate methods. Instead of relying on the vaccine matching, the R1 values, and as you heard from Dawn in the morning, some of these are not replicated in various laboratories. The use of animal challenge is quite expensive. So alternate heterologous testing can also assist. So in this regard, vaccine testing is an area that requires our effort to look at alternative methodologies. They could also think of reducing the cost of vaccine quality experiments. Can we look at alternatives such as using small animal models, or reducing the number of large animals by defining the most appropriate surrogate measures for protection, as the example of the effort by the World Reference Laboratory. So in this case also now, the other thing is the availability of an independent vaccine quality control mechanism. It is also been highlighted by the previous speakers on the role of PanVac as an independent quality control institution. In this case, the OIE twinning project for the World Reference Laboratory and AU PanVac in the selection of representative antigen panels for regions is in line with the identified situation where FMD seem to exist in 3 regional pools. So specific reference antigens can then be selected for the various pools. And in that case, the efforts towards that harmonization, selection of reference panels is a welcome move. The other thing I wish to mention, as I said, most of the challenges have been well enumerated before for us, is the being able to suitably determine field effectiveness of the vaccines. A lot of efforts, therefore, should go in that direction. And I wish to say, let me stop there in the interest of time, having highlighted the key challenges and the areas to be prioritized for vaccine research. I wish to thank the organizers of this conference and my colleagues for the presentation. Thank you.
Thank you, Abraham. And thank you to all our speakers today. We had some very informative talks that I'm sure will generate some good discussions later on. So we're going to move on now to the roundtable discussions, and we have 2 panelists sharing that discussions. I'm going to hand over to Samia to introduce our first panelist.
Thank you, Pam. Excellent. We have tons of questions. I'm not sure roundtable discussion we're able to answer all of them. But we'll try to do our best, and if we're not able to answer all of them, we'll probably can put some of the answer in the reports. So one of the roundtable panelists is Dr. Martin Elliott. He's here. He's a veterinary surgeon with an expertise, a wide range of expertise in regulation of veterinary vaccine with a specific interest on foot and mouth disease. Martin has spent much of his career working for various regulatory authorities, including Vet Vaccine Directorate in the UK, European Medicines Agency, Australian Pesticide Vet Vaccine Authority. So he is very well vested with the regulation of vaccine. He has also worked in the industry in various roles in manufacturing, regulation, technical support, particularly foot and mouth disease, and antigen banks. More recently, Martin joined the EuFMD to support the introduction of the pre-qualification process for fast diseases, including, of course, foot and mouth. So we introduce the second panelist on the roundtable. Pam, go ahead.
Thank you. So our second panelist is Dr. Fedra Eble. She has been working at the Wageningen Bioveterinary Research in the Netherlands since 1996, where she has been working on TAGs and FMD. She is involved in the organization of multiple studies for several international organizations in which the efficacy of FMD vaccines is evaluated. She is also a member of the Executive Committee of the Global Foot and Mouth Disease Research Alliance, as well as a member of the Special Committee for Surveillance and Applied Research of the EuFMD. Together with Aldo Decker, she is the head of the WBVR FAO Reference Center for Foot-and-Mouth Disease, and her interests lie in the fields of virology, vaccinology, and epidemiology. So we hand over to Fedra and Martin to chair the roundtable discussions.
Okay, thank you, Samia and Pamela, for your introduction, and belated good morning, afternoon, evening to everybody. And I would like to take this opportunity to thank the organizers for another successful workshop mutually organized by the GFRA and the EuFMD. And also thanks to the presenters for their very interesting presentations. And workshops like this always make me realize how important the work on FMD that we do is. We are in Europe relatively safe, but especially for those countries where the disease is still endemic. It's so important that we coordinate the work that we do. And Martin and I have the honor to try to coordinate the panel discussion, and we will try to pass through the question asked in the Q&A section. So some of the questions are really, well, broad, not specially targeted to one of the speakers, and some already have been answered either by helpful colleagues or by the speakers themselves. So I will just start with a couple of questions for the first speaker, which is Don King. And Don, I have a question from Aldo and a question from Nagendra, which you can answer both. And Aldo is asking how relevant was the type A antigen that scored relatively low in one of your essays. And Nagendra wants to know how practical is this approach for other regions, and how do you think it could be made available more broadly?
Thanks, Phaedra, and good morning to everyone. And it's a pleasure to join this panel session. I mean, I suppose just to answer Aldo's question, the data I presented in that slide was illustrative data. It wasn't real data, but it's fair to say we have seen examples of antigens with that type of profile, which sera that has been collected from different after vaccination fails to neutralize particular antigens. And so I mean, that particular example is just an illustrative example. It's not a real example. It's not real data, but the point would be, as I said in the presentation, that within the viruses that are encompassed within the reference strains, there is quite a lot of antigenic diversity, and to some extent, some vaccines that are provided by companies for supply into the East African market do fail to neutralize some of the strains that are in the panel. So that's an important message, but you don't want to perhaps take too much information from that illustrative data. Hopefully that answers that question. Aldo, I'm happy to answer anything further if you want to go into more detail regarding that. In terms of Nagendra's question, I mean, I think it's a really important question, which is, when you propose a new system to evaluate vaccines, you've also got to question the expense and resources required to undertake this work, as well as the sustainability of the work looking forward. I mean, I would make quite a strong argument that this is a very simple system. It doesn't require any novel diagnostic technology that isn't available in most of the OIE and FAO reference laboratories already. And so from that perspective, I think we're already fully equipped to undertake this work. I think probably, as I said in the presentation, there's a couple of things that need to be undertaken as high priority. One is to make sure that we calibrate the VNT methods that are used in different laboratories. Of course, that will be important if testing is done in different places. And then we need, of course, mechanisms and agreements to share these reference strains so that we're all using the same viruses at the same time. But beyond that, I think it's a very straightforward process, and I can't see really any big obstacle to rolling that out. And I'd say beyond the work that I've described for East Africa, we're already using similar approaches within projects in Asia. to evaluate the performance of vaccines. And again, you get very useful data from the use of these reference strains and when they're used to evaluate post-vaccination responses.
Thank you, Don, for your answers. I think they're very clear, and thanks again for explaining the system so well. Martin, can I hand over to you for a question to one of the other presenters?
Thank you, Phaedra, and thank you, Don, and thank to everybody who's presented this morning. There's been some excellent presentations, and what I would say, trying to track all the questions and answers, all the questions that have been generated. There's an awful lot of questions, and we won't get round to addressing them all this morning. But what we will do in the report is make sure all those questions are captured and give a full and complete response to those questions. Some of them are very specific technical questions in the use of FMD vaccines. As Phaedra said, some are quite broad, which might involve a more extensive answer. But I think we can only select a few of the questions. And then I have one really for Baddy on the ag results project. There's a couple of questions here from Salou. I think one of the first question really is what is the role of the public sector in terms of establishing these private public partnerships, and how do they differ from the regular donor funded projects that have been unsustainable? So that's the question. And a third part of that question is there a need for collaboration between development agencies and public institutions and private sector companies to overcome the major challenges? So there's sort of three parts to that question, Baddy. Thank you.
Yeah, thanks a lot, Martin. I think those are very interesting questions, particularly on if I start from the role of the public sector in PPP formations. From the framework that we did in the Eastern Africa region, we realized the public sector currently plays a bigger role in terms of control and management of FMD in their countries. So there is a lot that the public sector is doing. And yet the stakeholders were very clear that there are some gaps that they think if the public sector could be able to create some room for private sector to come in, then the fight against FMD would really be more achieved, or will be more successful in terms of addressing that challenge. So I think going to the public sector, what we got was if the public sector could come out and sort of give some clarifications. Like, I'll give you an example of the Kenyan situation. There are some cases where the DVS in Kenya came out and gave a notice, just to clarify in terms of vaccines and vaccinations, which opens up the door for discussions in terms of public sector. But if there was that openness between the public sector and the private sector to come in, I think it will really create a more sort of enabling environment to encourage PPPs, because the need for PPPs is quite established. But also the private sector need not wait for the public sector to be the initiator, because also private sector can actually take this discussion to the public sector. A case in example is in Ethiopia, where now they've moved into the public sector and the private sector have come in together, and now they are establishing guidelines for engagement. So this is a positive development. When it comes to the collaborative roles of institutions, we know, like, even OIE has been, particularly OIE public-private team has been on the ground in trying to promote the dialogue and in trying to bring these discussions around public-private partnership. So there is a lot of work that the OIE PPP team is doing to try and build capacity also to the veterinary sector. But also the role of the donors, I mean, in terms of bringing people together. In my presentation, I mentioned even donor organization and development partners like Mexico in Uganda are already trying to pilot PPPs, because by showcasing these examples, then you can encourage more participation and people coming in into the discussion. So there is a lot of collaborative work that can be done on the donor area. I know I was in a discussion with IGAD-ICPALD around FMD harmonization, vaccination harmonization between Kenya, Uganda, Ethiopia, and South Sudan. And there it was identified that the donors and collaborative partners could come in and initiate that those initial stages of the discussion. But I was not quite clear whether the question was coming into the project, our project in respect to sustainability, or I was not that quite clear. There was that part that was asking in terms of how the project, is it the FMD project? I could answer to that, but if I get that clarification because of time.
Okay, no, thank you, Bernie. I think that's a comprehensive response. So I think unless there's a specific burning question, somebody can put their hand up, but otherwise I hand back to Fed to address some other questions to the other panelists. No, thank you very much.
Yep, thank you.
So Phaedra, it's your hand over to you.
Sorry, I was still trying to. Yeah, I'm like Martin already mentioned, there are a lot of questions, and I think we can promise that we will answer all of them. But I try to just divide the questions a bit among the speakers, and so here I have a question for Dr. Masbuduma. And the question is again from Nagendra, and it says, how can we streamline the evaluation of the FMD dossiers across the regions? Can you give your opinion on that, please?
Thank you very much, Fedra, for that. I think there was the previous presentation, I think, made highlight of a methodology that could be followed in terms of trying to streamline dossier evaluation, more so that we understand that really FMD is a very complex disease. And as has been said, you'd find that a lot of national or registration bodies will not have the capacity to really interrogate the various FMD dossiers, especially when it comes to issues of strains and so forth. So I think through a Ppps model similar to what was presented earlier on, where experts, leading experts, would be able then to infer to products that have been registered in other regions and be able to really evaluate the appropriateness of those particular vaccines for a particular region. I like the approach of AgResults, where you really have a panel that can be put forth, and really whoever wants to come into that region is able to really satisfy that the product is able to work against such a panel. So I think really it would be difficult for every individual regulatory body to really evaluate due to the complexity of the disease. So I would advocate for a much higher collaborative body that would be able to interrogate these dossiers on behalf of the different regulatory authorities, either at regional or at international level. Thank you.
Yeah, thank you for your answer. I think that's a very well, clear view and a good way to tackle this. Yeah, I'm not sure. I'm looking at the time. It may be best to go for a question for David. Martin, have you selected one for David, please?
Yes, no, thank you, Phaedra and Dr. Mckay. There's really question. There's quite a broad question in relation to the pre-qualification initiative and the overarching sort of goal of vaccine security. Is what do you think are some of the key actions that that private or public bodies should take to promote vaccine security in endemic settings in Africa? So it's we have not a huge amount of time to address that one, David.
No, very quickly. But I think there's a couple of things I'd like to raise that have come up, and in fact addressing that last question about how do you promote registration across Africa. I've been working particularly with the East African Mutual Recognition Procedure to promote harmonization of registration in East Africa. And in fact, if people are interested, there is an annotated version of their guideline on the data requirements for vaccines that has been annotated specifically for foot and mouth disease vaccines, and that can be found on the East African Community website. And that, I think, addresses many of the issues that have been raised today about how do you assure compliance with the OIE manual and assess these dossiers in a consistent manner. And I think there are several regional initiatives in West Africa, in SADC, in East Africa, that are looking to promote harmonization of registration, not only on foot and mouth disease vaccines, but generally. And I think actually linking the work on foot and mouth disease to these other activities on regulatory procedures would be very, very helpful, because, as you say, they're highly complex products to assess. And in fact, if you can come to agreement on how you assess foot and mouth disease vaccines, you can certainly do it with any other vaccine that is used, because it is probably one of the most complex. And I think the other one was around how do you promote interest from both public and private sectors. To me, the single most important thing, and it underlines everything we've heard today, is moving from a purely national approach to a regional approach. I think, if you need to look back as to why is it that investment in individual countries in Africa in FMD vaccines has generally been poor, it's generally been because manufacturers haven't had assurance on the security of their supply chain, and that products will be registered. And so I think moving to a regulated system and a regional approach, because the difference is, you're not going to get a company interested in gearing up to produce vaccines for a small market. It's just not financially viable. So the more regional the approach can be, the more likely it is that a company will invest. And therefore, I think the work that Don and the WRL are doing is so key to opening up the market, and for countries to, and this does require the regulatory authorities, the national veterinary authorities, and the manufacturers to all move towards that regional approach on vaccine strain selection, so that you actually have a viable investment opportunity. And if you look back with that view on what happened in South America, that is what kind of cracked open the commercialization of that market and the production of large volumes based on a regional will rather than the purely national approach. So that would be my contribution.
Thank you, David. And I'm just aware of the time for the chair and Fedra. Do we have time for one more question, or do we need to wrap up the discussions this morning?
Yeah, I don't know. Wilna, can we pose one more question for Abraham, maybe? Just to make it equal contribution of everybody. I have here a question, Abraham, and it is, what could be done to standardize the sera antigens for vaccine matching studies or serology-based heterologous testing in other regions of Africa, such as West Africa, and who should be encouraged to take a lead on this? Maybe we can do that as a last question. Thank you.
Thank you very much, Federa. As I said, the initiative by WRL is an example to follow. And as Don had said before, it's hopefully that the lessons learned from the East African selection of antigen panels can be tried in the other region, the other pools in West Africa and Southern Africa. Because of my shortened presentation, I wasn't able to go into details to say that that effort is what is informing projects like the agri results. So the lessons learned from East Africa can be applied in the Western Africa and probably also Southern Africa. So there is already experiences to borrow from. The reference, the OI and FAO reference laboratory network has a membership from most of the countries where FMD laboratories exist, and the members from West African laboratories can take the lead in this, of course, guided by the World Reference Laboratory and other reference laboratories. Like in West Africa, there's ANSES, the French reference laboratory. Somebody also has asked in the chat whether I think I was not able to mention all the vaccine producers, and I think I had started with Ppps. And so there are other vaccine producers in Africa other than BVI, OVI, Ppps, NVI. There is also vaccine production in Egypt and I think in Morocco. Thank you.
Thank you for that answer and even answering other questions in the chat box. Martin, yeah, what can we do? Can we just promise to answer all the other questions later in the report? Pamela, looking at and Wilna, looking at you for what would be wise? And you want to conclude now?
Yeah, we will try and answer all the questions and put it in the report. So, and the report will also contain the abstracts and as much information as we can provide. And I'm just going to hand over to Frank now to end the meeting for us, please.
Thank you very much, Wirina, and all the presenters. We welcome all the questions from members. You can type them out and we shall answer them as Wirina has said. So we look forward to read tomorrow's meeting, colleagues. Let's again attend, we get the knowledge and all the information that we have been accumulating over the years. On that note, I think Wirina and colleagues, we close our meeting and we move forward. I thank you. All right, bye-bye.
Thank you, everyone. Bye-bye.
Thank you.
Goodbye, everyone.
See you tomorrow.
Bye.
Thank you, everyone.